Welcome to this explainer. We're jumping right into a heavy-hitting legal analysis today, unpacking the massive regulatory and financial risks surrounding ethical marketing in the medical device sector. To do this, we're using the SASB reporting standards, specifically for medical equipment and supplies, as our analytical framework. Because as we're going to see, what might seem like a totally standard marketing push can actually turn into a catastrophic financial liability overnight. Here's a quick look at today's agenda. We're covering 4 main areas: the medical marketing tightrope, off-label promotion penalties, the ethics of physician outreach, and finally, tracking and ensuring compliance. Let's get to it. Section 1. The medical marketing tightrope. So this entire explainer draws directly from the SASB standards for the healthcare sector. And what makes this specific document so fascinating is that it actively forces companies to categorize and quantify their operational risks for their investors. We aren't just talking about business ethics in some abstract philosophical way here. They were literally putting a hard price tag on risk. This quote right from the summary perfectly captures the fundamental tension we're looking at. Direct-to-consumer ads and physician outreach are massive, essential growth engines for gaining market share. But, and this is a huge but, those exact same strategies create incredible regulatory challenges the second a company gets tempted into marketing off-label uses. The line between aggressive sales and a federal regulatory breach is razor thin. Section 2. Off-label promotion penalties. Sticking to approved uses is absolutely crucial because wandering into off-label territory triggers immediate, severe legal scrutiny. Off-label promotion is when a device is pushed for a condition it was never explicitly cleared for. Now, a doctor can legally use their own medical judgment to prescribe a device off-label. That's fine. But the company manufacturing that device, they absolutely cannot market it for that unapproved use. Which brings us to a massive, terrifying question mark for investors. Under the SASB accounting metric HC-MS-270A.1, companies are legally bound to calculate and report the total monetary losses incurred from legal proceedings tied to false marketing claims. Think of it as a giant unknown price tag hanging over a company's head. Investors watch this metric like a hawk to gauge a company's true operational discipline. And make no mistake, we aren't talking about a slap on the wrist. These financial hits come from all sides. It could be civil settlements, regulatory penalties and disgorgement, or even full-blown criminal judgments requiring restitution. Whether an action is brought by a government body, another business, or a private individual, the financial consequences hit the bottom line incredibly hard. Moving on to Section 3, Ethics of Physician Outreach. Now, the SASB framework casts a surprisingly wide net when it comes to defining who exactly counts as a healthcare professional. You might just think of the surgeon in the operating room, but actually, this umbrella covers purchasing agents, practice managers, and group purchasing organizations too. The temptation to inappropriately incentivize a hospital purchasing agent is scrutinized just as harshly as buying a lavish dinner for a doctor. Any interaction here opens the door to strict laws surrounding fraud, abuse, and corruption. Because of this sprawling network, companies are forced to report on 2 distinct financial nightmares. On one side, you've got monetary losses from false marketing and off-label promotion. On the other side, you have monetary losses resulting from bribery or corruption. Both of these metrics force total corporate disclosure, essentially lifting the veil so investors can see exactly how ethically a company is really operating on the ground. Okay, I want you to pay close attention to this detail because it's pretty staggering. When these companies report their massive monetary losses for false marketing or bribery, those totals explicitly exclude their legal defense fees. Seriously. The numbers reported to investors don't even factor in the exorbitant army of lawyers hired to fight these battles. It is purely the penalty, settlement, or restitution money. So the actual total cost to the company, it's significantly higher. Finally, Section 4, Tracking and Ensuring Compliance. With such catastrophic financial risks on the table, you have to wonder, how do companies actually protect themselves? How do you rein in a sprawling global sales force? What do you do when a rogue rep crosses the line with a practice manager? Better yet, how do you stop it before it even happens? Investors demand to know that there's a rock-solid system in place. Well, according to the source text, simply having a generic code of ethics in a drawer somewhere doesn't cut it. Companies have to explicitly describe their internal compliance mechanisms. We're talking disciplinary actions, internal audits, strict regulatory review committees, and comprehensive training. And they can't just say, yeah, we do training. They have to track and report the actual degree and frequency of it. This is the absolute first line of defense against off-label marketing.
They're essentially required to lay it all bare. They have to detail their specific rules around food, entertainment, and formulary committees. Sure, but they also have to define the scope. Investors want to know exactly what percentage of the staff this code actually applies to. It's a demand for complete top-to-bottom transparency.
So the ultimate takeaway here is a total shift in perspective. In the medical device industry, ethical marketing is absolutely not just some nice-to-have moral obligation tucked away in an HR handbook. Ethical breaches translate directly into hard, reportable financial losses that destroy shareholder value. Compliance is literally a core business function. Thanks for joining me for this explainer. I hope it gave you a clearer picture of the incredibly high-stakes world of medical device marketing. But it does leave us with a pretty heavy question. We've seen the metrics, the definitions, and the potential for devastating criminal penalties. But as long as the potential profits from direct-to-consumer ads and aggressive physician outreach remain so sky-high, will the temptation always outpace the compliance? Are internal audits really enough to hold the line?